But there are still remaining challenges with the Affordable Care Act. First of all, almost 30 million people remain uninsured. So the ACA, you can see in 2014 and the year after that, a real and meaningful reduction in uninsured in the United States, but it was reduced by less than half. So most of those who were uninsured remain uninsured today. This is in part because not all states expanded Medicaid. There was the Supreme Court decision that said that states have the option. So those states that opted out of expansion were the ones that had most of the uninsured to begin with. I'm from Texas. Texas is in orange, not adopted, and it's also in blue, among the highest rates of uninsured in the country. And also, there was actually a lot less participation in the private insurance exchanges than was anticipated from the beginning from people like the CBO, these agencies that are in charge of projecting that information. So if you look at this graph on the left, when they were projecting in 2010 and 2013 the millions of people who would be enrolled in these private insurance policies, it was about 10 million over the actual number enrolled by the year of 2016. On the flip side, when it comes to participation in Medicaid, despite the fact that so many states ended up not expanding coverage, the darker teal line that shows their 2013 projections, that's after they updated for the Supreme Court decision. The actual levels of enrollment is much higher than their 2013 projections, which is the opposite of what happened in the private insurance. So the projected change in uninsured was about right, but a lot more of it happened through Medicaid than through the private non-group markets than was anticipated. And it kind of makes sense, I think, that there are a lot of suggestions that people get a lot of gains from Medicaid coverage. It's essentially free. So we can see on the left here, there is a statistically significant reduction to the poverty rate in the United States, and also a significant reduction in home evictions when Medicaid expansion takes effect. And on the other hand, the marketplace coverage is maybe not as good as the planners had thought. So a majority of people who were eligible, even those eligible for the private subsidies, meaning within the income range for eligibility for subsidized private non-group coverage, elected not to enroll. Part of the problem is that when you are uninsured, you do have access to emergency care. Little else but emergency care. If you do end up having to go to the emergency department, usually you can negotiate and threaten to or actually file for bankruptcy. Hospitals don't want you to file for bankruptcy because if you do, they don't get paid. So actually the evidence suggests that they tend to negotiate a little bit better than whatever you would lose in bankruptcy. Regardless, in the end, hospitals every year recover only about 10% to 30% of the overall bills that they give to uninsured patients. So you kind of have nothing but emergency coverage as an uninsured patient. But then in these private insurance marketplaces, they have really high deductibles. So every month you're paying out of your pocket a premium, but you still face, a $3,000, $4,000 deductible, so that you still have to pay out of pocket for all of your care unless you end up in an emergency situation, which means that there's kind of a lot of overlap in what it feels like to be uninsured and what it feels like to have high deductible private coverage. So it might not do a great job of drawing participation among these populations. Some of my work that's currently under review shows that bankruptcy is cheaper than reaching the deductible for about a quarter of the targeted marketplace population. So in conclusion, the US model has this mix of public and private programs, which can be contrasted with those more singular and egalitarian models that are popular in Europe and in Asia. We're going to study those models next week. With the introduction of the Affordable Care Act, the American model underwent some substantial changes, and meaningful changes, but still it kept its distance from those more unified Beveridge and Bismarck models that we'll talk about next week.